Intralesional Kenalog, you will need alcohol pads for cleaning the area, the Kenalog itself, which comes in 2 concentrations, 10 milligrams per ml or 40 milligrams per ml, and a syringe for drawing up the Kenalog along with a larger gauge needle. You can also use a smaller syringe depending on how much you'll be injecting, and then a small gauge needle for injecting. I recommend a 30.5 gauge needle, which is the smallest gauge needle available in most clinics for injecting. Usually we draw up with an 18 gauge needle, but this should never be used for injecting into the skin because of pain. If the concentration is not what is necessary for you to inject, you can always dilute with saline, and then you'll dress the area with a bandage and can always capture any blood with gauze. There are different ways to achieve the correct concentration of Kenalog for injecting. When considering injection concentration, you should think about the appropriate side effects that you may have with each of the concentrations of Kenalog. 40 milligrams of Kenalog injected into the skin can result in hypo or depigmentation of an area, along with skin atrophy or skin thinning. As such, you should be very careful, especially in patients with more pigment in their skin, about injecting such a high concentration. It should really only be reserved for either the most inflammatory conditions or when patients are very aware of the side effects that may be occurring. In general, most patients can achieve the necessary symptomatic relief with 10 milligrams or less of concentration. And when injecting on the face, you will want to go for always 3.33 milligrams per cc or less when injecting. We will show you now how to inject each of those different concentrations. In order to dilute your Kenalog injection, the first thing you'll do is remove the cap from the Kenalog. Then clean off the top of the cap and mix the Kenalog. To mix the Kenalog, take your large gauge syringe and mix with the plunger. Ensure that you're getting all of the condensed Kenalog at the bottom mixed in throughout until the Kenalog has a uniform consistency. If you were injecting 10 milligrams per cc, then you do not need to dilute it any further, as it is already at 10 milligrams when it's in the green cap or listed as 50 milligrams per 5 ml. If you wish to dilute it further to, say, 3.3, which is a concentration you would use, say, on the face or in a patient with concerns about depigmentation, you would draw up 0.3 mLs, then remove the cap from the saline, clean the area off, and draw up an additional 0.9 until you've achieved 3.33 mg per cc. 0.5, and this is just like extra information. 5 mg per cc is a good concentration in patients with more pigment in their skin, and especially for injecting into the scalp, especially in patients with alopecia. Draw up 0.5 mLs of the Kenalog at 10 mg per cc, and then draw up another 0.5 of the saline. Milligrams per cc is used primarily for injecting keloids. This concentration requires significant mixing, as was conducted previously. You can either inject 40 milligrams, or if there's concern about depigmentation, you can dilute down to 20 milligrams per cc by drawing up 0.5 and then further diluting it with the saline. This patient has granuloma annulare. The features of granuloma annulare include a red to brown dermal papule or plaque. In this case, it's configured in a semi-annular pattern. We will be injecting this today as it's a standard treatment for granuloma annulare, and it is the patient's preference. In order to inject the area, first, we will verbally consent the patient by reviewing all the side effects with the patient, including the risk of skin thinning or skin lightening. These are the primary risks. Patients could have a theoretical risk of infection, though this is very uncommon. We'll then clean the area off with an alcohol pad. Next, we will take our diluted Kenalog. In this case, we will be injecting 5 milligrams per cc. Please ensure that you have removed the wide gauge, which is 18 in this case, which was used in order to dilute the Kenalog, and place it in a sharp container. Next, you will place the smaller gauge needle on. In this case, we'll be using a 30.5 gauge needle, which is the smallest one possible. We always inject in the area of inflammation. For the scalp, the area of the inflammation is deeper, close to where the hair follicles are in the fat. For granuloma annulare, it's in the dermis. We're going to do a superficial injection there. We're going to be doing an injection, okay? You'll feel a small pinch. Do a small injection into the dermal process. In this case, we can see where we injected because the skin color changed. We'll then ensure that the needle is capped for our safety and place the needle in a sharp container. If there's any bleeding, you may place a bandage on top